Clinicians have relied on radiographs and explorers as their primary aid in the diagnosis of dental caries. However, studies have shown that radiographic images would only detect up to 50% of existing occlusal carious lesions, a significant drawback to relying solely on dental radiographs. To address this issue, Dentsply Professional presents the Midwest Caries ID Detection Handpiece, a portable, handheld device designed to aid in the detection of caries in non-restored occlusal pits and fissures and interproximal areas on posterior teeth. This module will explain the science behind this innovative product and show how its combination of LED and fiber optic technologies enables clinicians to quickly and easily detect up to 92% of occlusal caries. The Midwest Caries ID Detection Handpiece uses a specific optic signature to detect the difference between healthy and decalcified teeth. To understand how this works, let's examine how light reacts to enamel. The enamel structure of a tooth is made up of enamel rods. When healthy, these rods are straight, tall, and closely packed together in a translucent, crystal-like structure that allows light to pass through. When decalcification occurs, this crystal structure breaks down, shortening the rods and allowing more spacing between them. As a result, the tooth becomes less translucent than healthy enamel. This creates a specific optic signature that is recognized by the Midwest Caries ID Detection Handpiece. To detect caries, the Midwest Caries ID Detection Handpiece emits the LED light which passes through the enamel rods. It then uses three separate fibers. One emits a green light, the second emits a red light, and the third fiber is a non-colored receiving fiber to collect light from the tooth. If the enamel is healthy, the LED light is absorbed into the tooth and the green light remains on. If the enamel is demineralized and decay is present, the LED light will be reflected, refracted, or scattered. The non-colored receiving fiber captures this light, the green light is extinguished, the red light is illuminated, and an audible tone is heard, alerting the dentist that there is a change in tooth structure. With the Midwest Caries ID Detection Handpiece, diagnosis is simple. A non-red or greenish light indicates healthy tooth structure. Presence of the red light with an audible tone indicates decalcification of tooth structure. The Midwest Caries ID is able to identify significantly more caries than traditional radiographs. In fact, clinical studies have shown that the Midwest Caries ID is 80% accurate at detecting interproximal caries and 92% accurate at detecting occlusal caries. Compare these numbers with 50% and 39% for traditional radiograph detection, and it's easy to see how the Midwest Caries ID can dramatically improve your ability to detect caries in posterior teeth. To use the Midwest Caries ID Detection Handpiece, first assemble the unit. Once the unit is assembled, the probe must be calibrated. To calibrate, activate the handpiece by quickly pushing the on-off button. The handpiece will emit steady beeps, indicating it is in calibration mode. Place the tip of the probe in the center of and perpendicular to the wet ceramic calibration target. Hold the probe tip in place for 1 second after the red light is extinguished and the handpiece emits 2 quick beeps, confirming that calibration is complete. The probe must be calibrated after changing the probe. For complete assembly and calibration directions, please refer to the Directions for Use guidebook. To power on, simply press and hold the on-off button for 1 second until 2 beeps are emitted. The tip must be pointed in the air when the unit is turned on. To detect occlusal caries, gently place the probe tip directly on the wet pits and fissures, maintaining direct contact in the long axis of the tooth. There is no need to apply excessive pressure against the tooth surface. When caries detection is positive, the light at the tip changes to red. The speed of the audible signal is proportional to the amount of decay detected. A rapid pulse indicates a high level of decalcification. A medium pulse indicates a medium level of decalcification, and a slow pulse indicates a small amount of decalcification. When caries is detected, pivot the probe tip in all directions to determine the size and direction of the decay. To detect interproximal caries, scan from the occlusal surface on the mesial or distal marginal ridge in the long axis of the tooth with a slight angle toward the interproximal area. In both cases, a large positive area corresponds to a large area of decay underneath the surface. The Midwest Caries ID detection handpiece provides clinicians with an accurate, easy-to-use instrument. One probe detects both interproximal and occlusal caries while providing clinical access and enhanced visibility, and the visual and audible caries detection signals provide an ideal end-user interface. The probe must be used in wet environments, so you don't have to spend time drying the teeth. The lightweight, cordless handpiece improves clinician comfort and reduces hand fatigue. The outer housing, probe, and calibration target are autoclavable, reducing the risk of cross-contamination. The Midwest Caries ID system comes complete with the probe, shell, and detection module. It also includes a custom cassette, ceramic calibration target, fiber optic cleaning swabs, AAA lithium batteries, and directions for use. The kit also includes polishing papers designed to polish the tip of the probe. It is recommended that the probe be polished after every 5 uses or when needed to clear debris. To polish the probe, move the probe tip in a figure-8 motion against the dull side of the paper which has been dampened with water. The Midwest Caries ID detection handpiece is a valuable adjunctive diagnostic tool that can help improve the detection of dental caries. It reduces the risk of caries misdiagnosis by identifying up to 92% of occlusal and 80% of interproximal caries in unrestored posterior teeth. Non-invasive and easy to use, the Midwest Caries ID detection handpiece enables you to provide a higher level of care to your patients. To help improve caries detection in your practice, choose the Midwest Caries ID detection handpiece from Dentsply Professional.